thank the Houston Food Bank, the largest food bank in the country. We're here in the 18th Congressional District. Congresswoman Sheila Jackson Lee, thank you again. This is the queen of testing, and so we certainly appreciate her efforts. And then, of course, I can't say enough for Houston Police Department, HPD. They provided security for almost all of our food and mass distribution, so I can't thank you enough. And it's fitting that it's being hosted right here at the Northwest Command Station in North Houston. So again, look, we know that the food insecurities are real, okay, and we see that everywhere we go. So the food insecurities are real, pretty much driven by the economic collapse caused by COVID-19. And then at the same time, proud of our city in terms of how we handled the situation in March and April. Our numbers were relatively low in comparison to so many other cities across the country. But in the last, let me say, 2 weeks, 2.5 weeks, we've noticed the numbers going up and going up dramatically, moving in the wrong direction very quickly. And as a result, the surge is occurring. More people are being infected. More people are showing up in the hospital rooms, more people in ICUs. The positivity rate in the city of Houston has gone from 3% to well over 11% and increasing. So we are now having to address this surge, and we're having to move very quickly to try to get on top of it to blunt the progression of this virus, to slow it down, and to make it more manageable, since we're going to have to be living with it for quite some time. So 2 things being done the other day: the food insecurities, the mass distribution, and providing people with the information that they need. So let me just stop there and take whatever questions. And you can pose your question to myself, to the Congresswoman, to Pastor Meacham, any one of us.
Mayor, did you also mention her task force?
Oh, I also wanted to acknowledge, I set up well over about 6 weeks ago, maybe 2 months ago, the Health Equity Response Team, the task force for the city of Houston that focuses specifically on at-risk and vulnerable communities. Even though this virus is an equal opportunity abuser, it's having a disproportionate impact on communities of color and especially low-income, underserved, under-resourced communities. And representing the HER task force today is Shannon Buggs, who is the director of Complete Communities, as well as Dr. Kathy Flanagan, who's one of our leading doctors in the city of Houston, who's also serving on that task force as well. And so they are charged with making sure that we provide, number one, that no Houstonian is left out. That's number one. Number 2, providing information to our at-risk, vulnerable communities, and not only information, providing resources as well. And so they have already distributed hundreds of thousands of masks, again, helping with the food insecurities and providing the others healthcare services, you name it. So I really want to give a huge thank you to the task force, to the Health Equity Response Task Force, that they have taken and are running with it and meeting tremendous needs. So thank you all so very, very much. And Janice, where's Janice? Oh, Janice, the lady with the rainbow hat on, who's my faith-based community service director. So thank you, Ms. Janice Weaver. And to show you just how things fit together in our community, Ms. Weaver is a member of Starlight, Pastor Meacham's church. So everything becomes very, very connected.
And we'll take questions now.
And hold on one second, but just for Councilwoman, any remarks before we take questions?
Just briefly, Mayor, just to be able to say that one of the things that Houston exudes is that it is a stand-up city. And I think Houstonians and those in Harris County need to realize that. The mayor knows that we are suffering on the federal level with over 2.5 million that are cases that are growing. And then as well, we have 126,000 that have died. And we have a large number of cases in this resurgence, if you will, that has come about through COVID-19. But the point that should be made is how much work has been done in Houston and Harris County to have had the numbers where they were. And that is with task forces that dealt with the devastation of the disparate impact of African Americans and Latinx communities. And it was stark here in Houston as well, where the numbers were fairly evident that the numbers of cases were higher in the African American community and the number of deaths. At the same time, this community has made a commitment, this community, Houston and Harris County, to testing. and we have a public-private relationship going where there's testing in that public-private structure. There is testing in the federal structure, and we're working to utilize the state structure. Overlapping tests, but we're not where we need to be. But this community got out in front and said testing, testing, testing. Now we're going to expand the extension that the federal government has given us. We wanted 60 days. We've got 2 weeks, and I understand that they will look 2 weeks and then look at what the needs are. But the response that we have gotten to date has been because this community has collectively worked at all levels of government. Mayor, I thank you. And we know that one of the things that you're asking us for that sort of helps your task force, helps Pastor Meacham, is to hurry up and get the HEROES bill passed so that we can get the funding you need to help keep our first responders. That is going to be very important, and as well for all of your essential workers to make sure they have hazardous pay. So I think that is extremely important, and I'll just finish on this note. The pace that the mayor and county were going at, we all joined in and supported, all of his congressional delegation. Now we want that pace to come from the state to slow down. And I personally want them to reassess stay-at-home orders to be able to address the question here, or to give the authority to the mayor and our county judge. So we have stood up here in Houston and Harris County. We're going to continue to stand up, and I'm going to continue to work with the mayor and county judge to do the best we can for the people here in this community.
Houston, as the Congresswoman referenced, has gone through a period before from this and worked through it, and the numbers didn't go up too much. Now you're seeing a surge. What do you need to do differently this time? What are you doing now to respond to it? And are you worried, given the number of ICU admissions, I think it's almost at 100%, if not 100 today, about a surge in deaths in a week or two?
Well, let me just say, in terms of doing things differently, what we did the first time was the correct things to do. They worked. I mean, as towards the end of April, the first part of May, the positivity rate was low. The number of people that had tested positively, in terms of their positivity rate, that was low. The number of fatalities was low in 100 and let's say about 130 or so. Today, the fatality number is right around 219, fourth largest city. So that's relatively low. What we are seeing, though, is that as we open, and I said it back the first week in May, I thought we were opening too fast, too soon. And then what has happened, and normally you don't see those numbers reflected for 3-4 weeks down the pike. In the last, let's say, in the last 2.5, 3 weeks, we started to see the number of cases going. Whereas one time I was reporting, let's say, 200 cases a day, people testing positive. All of a sudden, abruptly, that number went from 200 and so a day to like 600, 700. One day it was 1,789, 944. And so our average number right now in the city of Houston is about 750, okay, per day. That was never the case in March or April or May, never the case. And so we need to step back. You know, I think it is good, for example, that the governor now has ordered the closing of bars and clubs. I think that's a step in the right direction. Back on the occupancy numbers for our restaurants, going from 75 down to 50%. I think that's a step in the right direction. Pausing on any opening on anything else. But it's very difficult now to put the genie back in the bottle when the genie is already out the bottle. And so it's going to take all of us working collectively to clamp down, to blunt the progression of this virus, to slow it down. And quite frankly, what I would say, you know, just because a business may be open doesn't necessarily mean people need to walk in. And so we all need to recognize that what worked for us the first time are the same things that are required this time to blunt the progression. And it's my hope that 2 to 3 weeks down the road, we'll see those numbers reflected through our collective actions. But we're going to have to take some additional steps. I would like to see the mask, for example, order not just applied to businesses, employees, and customers, but across the board, if you're in large gatherings. So there are some additional steps that we need to take. But if we do it, then we'll save a lot of lives.
How do you deal with the fact that people might be fatigued from having, or tired from staying at home, from not seeing folks? So you work for 3 months have the energy to do it anymore?
Well, let's just put it this way. We may be tired and bored of the virus. The virus is not tired and bored of us. The virus never went away. We were managing this virus. Until there is a vaccine, we have to learn to live with it. We have to learn to manage it. And the reality is that's why you have to pace yourself in a very measured, methodical way. And, you know, I don't want to have to kind of go back, you know, keep looking back, but what worked for us in March and April, those things worked. And if we had opened in a much slower pace, then it would have been good for our economy and businesses as well. And so now with the numbers going in the wrong direction and going in the wrong direction very quickly, and a number of admissions in our hospitals going up, ICU bed utilization going up, now we're going to just have to take some definitive steps to blunt it, to blunt the progression, to kind of to put us in a better position to manage it. And if we work collectively at all levels of government. That's why I want to thank the Congresswoman for what she and others have done. The additional dollars in testing is helping to provide testing all over the city. You know, the support that we now need, even more so for local governments. Let me tell you, now that the virus is going in the wrong direction, it's putting us tremendous strain on our resources. I mean, a tremendous strain because the virus is going in the wrong direction, which means it's working against us, our budgetary constraints. So local governments need that support now more than ever. So the support that's coming from the federal government, I appreciate the partnership that we have with the Queen of Testing, the Congresswoman Sheila Jackson Lee, and the support, and we need that support from our state government, because you do have to back up. I mean, and there's nothing wrong. I appreciate the governor acknowledging that opening up, for example, bars and clubs is too quickly, but we need to back up. And then we need not make these masks political. The very fact that you have a mask on doesn't mean that you're a Democrat, progressive, and a big-time liberal. You know, and the fact that you don't doesn't mean that you're a Republican and conservative. This virus has no affiliation with political ideology. It is an equal opportunity abuser, and if you socialize with it, you will get it. And neither does it deal with social economic status.
Mayor, may I respond before you take another question from someone else? Let me reinforce the importance of a consistent message coming from Washington, the state, and how the local leaders are leading. We have been able to come together in this community because of the mayor and county judge working together. There's been unity. I want to make sure they have a consistent message coming from Washington, and that is the scientists still believe that testing is important. And that's why I think it's important that the federal commitment to testing not stop, not be diminished, and that we continue to work with the state for it to be ramped up and to continue this public-private partnership. And I say to Houstonians and those in Harris County, we're all together. Take advantage of these testing sites and get yourself tested, because now we know that you may be asymptomatic and you still can pass on COVID-19. So as the mayor has indicated, yes, I've been saying it because I listen to scientists and doctors that I'm talking to, and they insist that it is important that we are tested so that we can stop community spread. And community spread then puts us in a predicament of more and more people needing food assistance, of which we are giving, because obviously if they have to be at home or they have family members that are ill, they have to take care of them. Many of them are quarantined. They've got to provide them food. And I even had to do that yesterday. So I think it is important that we keep testing. We don't close sites. We open sites and we expand that opportunity. And I thank the mayor for recognizing early of the importance of testing and as well the testing dollars. So, thank you.
Mayor, we have a couple of questions from the poll. Do you want to do that at some point? Right?
Yeah, and let me just say what HPD and others are putting out, the HERD task force are putting out, and that is wear a mask, save a life. And that's what it's all about, wear a mask and save a life. Okay?
So the Med Center stopped reporting hospital ICU capacity online after they hit 100%. Why do you think the Med Center is not posting those numbers more publicly? Do you think they should?
Well, I think they should. I've had a conversation. I think you will see as of tomorrow. I think those numbers are coming back. So that information was provided for the last, well over the last month. It was very helpful. I will get those numbers every morning. And so I noticed that I didn't get them on Friday and Saturday. I've had some conversations, and I think we're all on the same page, and that should be coming back as of tomorrow.
Gotcha. Should the Texas